Hello, hi. We are on a survey of deconstructing mains through simplified daily based preparation of mains questions which can be potentially asked in the upcoming descriptive mains examinations. We have already discussed the questions like application of biotechnology, then multidimensional contribution of science and technology in India. Today we will be discussing about nanotechnology and how is it helping in the health sector. Let us jump into the question. So this is the nanotechnology and its impact on the health sector. So as an introduction we have to write obviously about nanotechnology. It means the manipulation of matter at nanoscale. Nanoscale means 1/1000th of a meter. You can write about it. So it is involved in designing, creating, using materials, devices, systems with unique properties and functions due to the small size. Okay, so 1/1000th of a meter. So you can imagine how small it is. So in that scale you can create things, you can create devices, you can create many systems that will be having unique properties because of its extremely small size. So this is a small introduction. So how is it helping in the health sector? That is the core part of the question. So how is it helping? First of all, drug delivery. Okay, we know that these nano sized drugs that will be extremely small and that can actually be designed to deliver them to a target specific site with greater precision. So if you have a particular cancer tumor in the liver, without affecting the kidney or pancreas or any other tissues, you can directly deliver to that particular spot using nano coated drugs. So that will be reducing the side effects and that will be enhancing the therapeutic efficiency of the drug or medication. That's one application. Then imaging. We know that we have some medical imaging techniques like MRI scanning, CT scanning, ultrasound scanning, etc. But many times there is a limitation for the clarity of the image. But if we can use nanoparticles in such imaging, we can use that for improving the accuracy and sensitivity of imaging. Definitely you can write about that thing. Then diagnostics. In diagnostics, how it can be applied in diagnostics? Nano sensors and nano devices that could be used as for detecting biomarkers or pathogens at very low concentration. Okay, for example, if one particular pathogen has entered our body and if using blood test and all, it is difficult to detect because of the smallest or minutest concentration present in the body, but you can use this nanotechnology assisted tools for detecting even at such minute concentration. So that will be helping in the early detection of diseases like cancer and infectious illness, etc. We know that many a times doctors will say that okay, this is you are at the 4th stage, you could have come earlier and all, but before detecting it at the earlier stages, how we can get the treatment. So for such early detection, that can be used. Then in cancer treatment specifically, we know that we can deliver the therapeutic agents directly to the tumors. Nowadays we are using the technologies like chemotherapy and all, treatments like chemotherapy which is actually damaging the surrounding tissue cells and all. We know that how the condition of patients will be turning worse after the start of chemotherapy and all. So precision target that will be helping better addressing of the tumor at that particular target size. So this approach is known as nanomedicine or nanotherapy. That is a very big advancement. Then regenerative medicine. You or anybody had lost one limb or some tissues in an accident. So nanotechnology can be used to support tissue regeneration and repair. So it will be acting as a template, and over it new tissues will be regenerating and repairing that particular site. Okay, so that's an application. Then antibacterial application. For example, one particular area got a wound or cut. There is highly likely that new bacteria will colonize that particular area, turning that infection into maybe worse conditions, like you may need to remove that particular organ and all. So to combat that, we have developed nanoscale antimicrobial agents. Okay, nanoscale antimicrobial agents to combat drug resistant bacteria and all. Okay, there can be different conditions. like either you have developed a wound or cut, or in other case a particular bacteria have entered our body and we have tried to treat it through some drugs and all, but even that bacteria has developed resistance to that particular drug. So we cannot kill that bacteria using that particular drug now. Because of the application of nano scale antimicrobial agents, we can easily combat that particular drug resistant bacteria. So that is one application, that is antibacterial application. This can be used effectively in vaccine development and all. Then in wound healing, okay, in wound healing, you got a cut or wound in your body. So to like avoid bacterial and virus attack in that particular area, you can use nanotechnology assisted nano material coated wound healing dressings. Okay, that will be accelerating wound healing and all. You know that there are silver particles which are antimicrobial that will be coated in this particular wound healing bands and all. So that will be providing controlled release of therapeutic agents and promoting tissue regeneration. So in that wound area, new tissues has to develop to cure that particular wound, and you have to like give particular dose of these powdered drugs to that particular area. See, for example, imagine you have coated one wound with a bandage, okay, but every time you cannot remove this bandage to apply this kind of powdered drugs to that particular area. But this particular nano coated wound healing bandages will be releasing the therapeutic agents or drugs in the convenient doses to that particular area. So that is one thing. Then personalized medicine. Okay, personalized medicine means what? Nanotechnology enabled the development of personalized medicine or customized solutions by tailoring treatments to an individual's unique genetic makeup. See, I am having a unique genetic makeup, you are having a unique genetic makeup. The medicines that are applied to me won't be applied to you in every case. So you have to create new medicines by examining the genetic makeup of one particular person, by observing the genomic conditions of that particular person. That particular person will be having maybe inherited genetic disorders. So the medicines which can be applied in others' body cannot be applied in their body. So there are many limitations like that. So nanotechnology enables the development of such personalized medicine which can be used for targeted drug delivery to that particular affected site. So this is all about the application of nanotechnology in the health area. You can talk about drug delivery, you can talk about imaging technology like CT scan, etc. For increasing the contrast of the particular scanned area. Then in diagnostics, for early detection of pathogens, for that you can use nano sensors and nano devices. Then you can use that in cancer treatment, okay, for early detection of cancer, using for early detection and targeted attack of that tumor through nanomedicine or nanotherapy. Then regenerative medicine for supporting tissue regeneration and repair of a lost part or a wounded area. Then antibacterial application to combat drug resistant bacteria. When all other drugs fail to cure this particular bacterial infection, you can use antibacterial nanoscale antimicrobial agents for curing that area. Then wound healing bandages, okay, that will be releasing controlled therapeutic agents to that particular area, and that will be accelerating wound healing, and that will be preventing these kind of bacteria, okay, microbes to attacking that particular area. Then it can be used in personalized medicine, okay. I told that for different persons, different genetic makeup and different inherited disorders or things might be there. So for that, personal medicines is the need of the hour. So this is all about the application of nanotechnology in the field of medicine. So this is the third question in our series. So what we are doing in this lecture series is that we are training you to write keywords which are most suitable for addressing that particular question. So in nanotechnology in health sector question, definitely you have to write about nanomedicine or nanotherapy, then nanotechnology used for supporting tissue generation and repair, then nanoscale antimicrobial agents, wound healing bandages, personalized medicine, then as nanosensors and nano devices for diagnosing the pathogens at earlier concentration. Sensor means what? Sensing one particular thing. Even at the nanoscale it will sense. then it will be used as a contrast agent. So these kind of words has to come for improving the appealing or appearance of your answer. That will be giving you a better edge over your competitor. So if you are following these kind of sessions on a daily basis and you are brainstorming and training your mind to learn new keywords initially, later on you will be able to create such keywords on your own, because I am writing questions from the syllabus. Okay, either I am using previous year questions or there will be questions made directly by modifying the syllabus keywords. So in that way you could easily cover the syllabus as well timely. So in the upcoming session we will be attending one question about what is India's plan to have its own space station and how it will benefit our space program. So this will be the agenda for the upcoming session. So that's for today. Thank you. We'll see you in the next session. Bye.